Hey y'all, it's me, Angelina DM Trailz. I'm an undocumented Latinx drag queen here in Houston, Texas. You may know me from my Wednesday show Millennial Dolls at JR's Houston or Sunday Drag Brunch here at Barbo M or anywhere around the city of Houston. Today, I teamed up with Nasa to talk with Elia Chino, founder and executive director of community-based organization FLOSS, about ending the HIV epidemic in the US and how our local health departments can more effectively work with our club, nightlife, and Latinx community. How do you think like social media has helped or not helped enough with the HIV pandemic, and what do you think we should do?
And about the internet.
Yeah.
Yeah. If you want to know anything, you got to Google, okay? Go
I mean,
to
there's so
Google.
much false information too.
But it's a lot of false information.
Yes.
I understand. Well, we need to educate people that they must to have relevant information from sources that are relevant, like at the health department, CDC, because also the media, sometimes
they
they
flip.
put too much information. They care about the rating. That's what they care. They don't care about us.
Well,
And
you
the
know,
money,
the money, girl. Oh my goodness. I mean, it's so frustrating to just hear everything and, you know, relive a lot. But how do you think we can get better? And what advice would you give to people about getting educated?
Well, we have different angles, okay, to get information, the right information. I think the elected officials, they need to get educated also about HIV. Also, we need to educate all the entities across the schools, hospitals, the police department.
Oh my goodness. But yes.
Courts, everywhere, okay? But to ending the epidemic is a responsibility of everyone. It's not only the health department. We all must to be involved to end the epidemic. We need to get involved all the leaders in the community, churches, people that has playing role in different aspects, the football, the basketball things, all those people, the stars, they need to get involved also to send in positive message about how to end in the HIV epidemic. Because now what we have the best medication, okay? And what is the best medication for HIV? But also to find the new people that is affected. I don't like the infected word. Affected. Because a lot of people, they get insult, okay, with that word, infected. People affected with HIV, we need to look for those people, okay, to put in right in medication immediately, or they can be undetectable. Or they cannot pass now the virus to the people. The people that is in high risk, they must to receive PrEP.
Go get tested and then get your PrEP, yes.
And also their partners to get PrEP. But also people that are using needles and all that kind of stuff, they must to use PrEP too. And we need to continue, and the trust is so important. Why FLOSS is being able to accomplish and continue finding people affected by the pandemic is because we have been established for almost 30 years the trust from the community. Now we don't need to go and look for people, okay? People, they come to us because they trust us.
Yes.
But also I encourage the health department that they must to put incentives to motivate people to get tested for HIV and the clubs. Because it's one of the experiences that I have. When you offer in the clubs, okay, you know what? I'm going to give you $20 and come in and get tested.
Okay.
It's not about the $20. It's about to saving your life.
Yes.
It's about to finding other people that are maybe they have the virus and they don't know that they have it, and they pass it to other people, and especially the new generations. They that's the pandemic. That's what it is. This is key to ending the HIV epidemic in the United States.
And I want to talk about the new generation because you talked about how y'all didn't have phones, no social media, no internet, but we did. And that's what I had to do. My school didn't educate me enough. It could have been bad. That's what I'm trying to say. Even though with the information that we have now, it could have been, I could have gotten the wrong information. That's what I'm trying to say. With this new generation with internet. So it's also dangerous.
Okay.
So,
decimos en español es una arma de dos filos.
Dos filos.
Dos filos.
How do you say that in English?
Yes,
A blade of two, there's two blades to a sword.
Yes.
What is it?
Porque antes no teníamos el internet y la social media. Ahora lo tenemos, pero también el internet hook up, okay, que se conocen y se contactan y se juntan y tienen orgías y todos estos muchachos y chat rooms y todo eso. Y se juntan y van a tener relaciones sexuales sin conocer a las personas también.
Yes, I mean, yes, it lends to a lot more danger.
Yes, I'm HIV negative.
Good, good.
That's what I say. I'm so blessed because...
we're very blessed too.
Because I was in high risk, but because for the ignorance, because nobody was talking about condoms, nobody was talking about HIV in my age when I was a teenager. Nobody was talking about this. And I was in high risk, okay? Because a lot of people, we have unprotected sex.
Yes, I mean, all the dating apps, everything, everybody just wanting fast relief and just not caring. And it's like, do you care about your health?
But also I want to mention, is a lot of drugs out there.
Oh my goodness.
That people, they get lost and they do wrong things, and the next day they wake up. What happened to me?
Yes, and that's
another factor that
yes,
a lot of people is getting infected with virus.
That's the issue with the nightlife.
Affected.
That's the issue with the nightlife, that there's just so much going on. I mean, we have to deal with a lot of trauma as queer people already, and going out to the nightlife to our family, to our queer family, and having fun.
We almost born with the trauma.
We're almost born with a trauma?
Yes,
oh my goodness, don't say that.
As soon they find out that you are different, it's starting the discrimination.
The stigma, the discrimination. So what I can say to everybody is that, look, everybody, no, I'm sure, is around a queer person. I would say listen more to what they have to say. Or at the end of the day, you might have to ask what's going on, because we've gone through a lot as queer people, and we still are. We have a lot of trauma that we are born into. Like you said, that we need to be listened to. The biggest advice I can say is just listen to your friends, and
listen to your heart.
To your heart, yes. If you don't feel good, ask yourself, why don't you feel good?
Yes. And always ask for help.
Ooh, it's hard for me to ask for help. But yes, I would just say, really listen to people around you. If they don't feel good, they were misgendered. What's happened? Why? Why were you misgendered? How can I help you? Sometimes giving the help and not even necessarily waiting for somebody to ask you for help. Exactly. I think that's very important. And we need to be doing that as queer people. But, I feel sometimes we hurt ourselves more than in our community,
and people
too.
That we are here for you. We love you. We care for you. That is making a difference on the lives of the people that we see every day. That people, they don't have the fortune to be good in this life.
I want to talk about our Latin communities. When I was younger, mi abuelita she would grab my hand, me agarraba la mano, y when she would leave back to Mexico, it's like, te cuidas, mijo, eh? And which means, take care of yourself. And I was like, of course I want to take care of myself. Duh, I'll eat, whatever. But now that I reflect back on it, I'm like, oh, I think they're talking about HIV.
Take care more. Yeah, deeply.
I think they're talking about HIV. And this is very recent. I think just last year I reflected back and I was like, I think they saw what was going on in the 90s and they don't want to, in a way, just respect me and bring things up that I don't want to bring up, or, but all that they can say is take care of yourself. How about you, and what about your Latin family?
Well, my family, they never spoke about sex at all in the family. Never about issues about sexually transmitted diseases. Never about that. And I was very lucky, okay, that I was able to go to some college. Something that wasn't easy. I had suffering so much to have education. I want to go to the university, but because my parents was so poor, I wasn't able to succeed my dream. My succeed dream was to be a lawyer. That's what I want to be. Okay?
You can still be a lawyer.
I'm still, yeah.
Go do it. Do it.
Because right now I don't like to be a lawyer. Because I think God chose me for this, okay?
I'm gonna tell you. You told me that there needs to be healthcare workers that are gay. There needs to be doctors that are gay. There needs to be trans lawyers too. Okay, so go back and get your lawyer degree.
All right. It's a lot of careers that is needed so much bilingual. In this city. We need to have bilingual doctors for hormones for the transgender community. We need to have licensed social workers that speak Spanish, and we need to have a lot of LPCs that treat the LGBT community, because it's nobody that speaks English. And a lot of people, they are facing these problems right now, mental health problems.
Yeah.
And we must have the people with the licenses to provide these services, counseling. Yes.
Well, I can say that I think we're both very thankful to be here in the United States.
I always say, I love this city, the city of Houston, because the city of Houston saw me falls 1,000,000 times, but I also saw me grow another 1,000,000 times. And I remember that when I moved here, I did everything. I have 3 jobs. I come to this country to wash dishes, to clean tables, to do everything. But you know what? All those things I did, and it was a blessing, and I'm proud of that. Because we never can forget you or las raíces. Nunca tenemos que olvidar nuestras raíces. Never. We've been chosen as a gift, as an inspiration for other generations. And that's the only thing that I have to do, and that's what I want to do, to continue inspiring other people from the LGBT community that nothing is impossible. Everything is possible when you want to do something good for the humanity, for others.
Well, you definitely inspired me today.
Yes.
Thank you so much for all your work.
And we are making a difference in the lives of people that we serve and the lives of people that we know, and we must continue this.
Yes.
Fighting for human rights.
Period.
Yes. And I say, you know what? I'm suffering too much. I have all this pain. Y dije yo, voy a aliviar mi sufrimiento en ayudar al prójimo. Y yo me refugié. Este fue mi refugio. Hacer cosas buenas para la humanidad. Ha sido mi escape, pero un escape tan maravilloso que he encontrado lo más maravilloso, la satisfacción más grande, tan hermosa, sentirme feliz y contenta. Y el mejor reconocimiento es de ver a las personas que les doy la mano y que después se hacen independientes y que después tienen éxito en la vida. Entonces, también para mí, it's also a pleasure to meet you more, and that as a young people like you, we need more young people, fresh meat, to encourage other young people to do other things for the and benefit of the community. Continue inspiring the new generations, okay? And este es mi legado también que quiero hacer. Quiero ser una inspiración para las nuevas generaciones, para que surjan nuevos líderes que van a ser los que van a liderar las nuevas generaciones, porque ya estoy casi de salida, ya casi me voy yo, ¿verdad? Pero ese es mi legado más valioso que quiero dejar. Thank you so much, okay, for listening my stories.
Oh my God, I don't want to start crying again.
To listen all the struggles that I went through, all my journey of my life, and all the struggles that I had to face in, because I think I have a lot of things that I can do for the community, you know. And I ask God every day to continue using me for do great things for the community. Thank you, and thank you to see you again. Appreciate you for everything that you do.
Thank you so much.